According to the National Cancer Institute, it is estimated that almost 9,000 new cases of testicular cancer will be diagnosed in men in the United States this year, and it's on the rise in young Hispanic Americans. Dr. Douglas Chiriboga at Pomona Valley Hospital Medical Center discusses the risk factors.
Testicular cancers arise in the testicle, and 95% of these testicular cancers are of the germ cell type. There are two types of germ cell tumors, seminomas and non-seminomas, or non-seminomatous germ cell tumors. Men between the ages of 15 and 34 are at risk for germ cell tumors or testicular cancers. And of those, some of the risk factors that we've identified are men who've had a history of undescended testicle, men who've had a history of HIV. We also know that there have been some reports that men who've had a family history of testicular cancer are also at risk. Symptoms of germ cell tumors or testicular cancers, in this case, are men who have usually a painless lump or swelling in the scrotum. And they also will start to have, in about 10% of the cases, will have pain in the lower abdomen, the perianal area, or in the scrotum. We have modalities or imaging studies that we can use. Primarily ultrasound is one test we reach for early on to see if the lump is it a cyst or is it a solid tumor.
What are the treatment options for testicular cancer?
Treatment for testicular cancers, and primarily germ cell tumors, consist of what's called a orchiectomy, which is removal of the testicle. And at that point, we have several options. If they're, for example, if they're a seminoma germ cell tumor, then we could do chemotherapy to reduce the incidence of relapse in that particular patient. If it's a non-seminomatous germ cell tumor, you can also, obviously you would do the removal of the testicle, that procedure, but you would also then consider either radiation or chemo, or those are primarily the things we reach for.
Dr. Chiriboga talks about some recent studies on Hispanics and testicular cancer.
At a recent American Urologic Association meeting, they presented some research that showed the incidence of testicular cancer has been rising in Hispanic males. We're not quite sure the reason for this, but further studies are ongoing to determine what's caused this. But it's a cause for alarm, and I think it's a good entry point to be able to educate our patients about the importance of coming in to see their doctor, and to not be afraid to bring up with their physician a complaint of a painless lump or swelling. The nice thing about treatment for testicular cancer is that more than 95% of men who are diagnosed with testicular cancer survive. It's easily curable. We know that between the ages of 15 and 34 for men, it's one of the most common cancers in this age group. And we know that the incidence, the yearly incidence, is about 5.4 cases per 100,000 men.